Hi y'all, my name is Jamiah Nixon, as you can all tell, and as you can see, we are going to be discussing asthma. And I know we are all tired about learning and hearing the same topics over and over because obviously this is a very common topic discussed in pretty much every class that we have. As long as all you guys bear with me, I'll try to make this as short and sweet as possible, but also give you as much information as I can on this certain topic. So, here we have our objectives. By the end of this PowerPoint, hopefully, you all will be able to know the definition of asthma, to identify the risk factors of asthma, to identify and recognize the clinical manifestations, to identify the triggering aspects and its classification, to understand how asthma is diagnosed, to identify the prevalence of asthma, and lastly, to understand the treatment process. Now, what exactly is asthma? Asthma is said to be a heterogeneous disease, meaning that it has multiple components to how it develops and comes about. This is described as clinical manifestations, airflow limitation that can be reversed, and bronchial hyperresponsiveness. Airflow becomes limited due to the inflammation of the airways, resulting in bronchoconstriction, which also causes extra production of mucus in the bronchial tubes. The occurrence of asthma is precipitated by certain things known as triggers, which will be discussed later in this presentation. Promise. What are the risk factors? That is our next question that we are going to answer, and it is as follows. Gender, which is in children, males are more likely to be diagnosed with the disease asthma, but in contrary, as an adult, it's women. Next, we have obesity. Obesity is considered a risk factor because of the excess fat located on these individuals' lungs. It causes the strain to breathe in certain activities, which precipitate the symptoms of asthma, which will be talked about later in the slide. Now we will have genetics. Genetics is a major risk factor because of the genetic disposition atopy. Atopy has the tendency genetically to develop an allergic response to common allergens. Also genetically, if your family has asthma, it is a chance that you will also be diagnosed with asthma. So, what specifically are the triggers of asthma? I'm going to go over some of them, but not all of them. So, we're going to start with air pollutants, such as cigarette smoking or aerosol sprays. This is because these things irritate the airways in a way that it causes asthma to be precipitated. Then we have respiratory infection. This can be listed as viral or bacterial. And this is a major trigger because of the increase in airway narrowing and airway hyperresponsiveness. This specific trigger can also lead to exacerbation in asthma. Then we have exercise. Exercise causes induced or exacerbated asthma and is called EIA or EIB. And EIA means exercise-induced asthma or exercise-induced bronchospasm. EIB typically occurs after certain activities. In EIA, you have symptoms during those activities, which means you can be exposed to cold or dry air. This occurs because of the changes in airway mucosa caused by hyperventilation. Lastly, we have exposure to allergens, such as animal dander, cockroaches. I stay away from cockroaches anyway, pollen, etc. And it is encouraged to avoid. There's no specific connection to why these things cause asthma or cause a trigger in asthma, but it is still known to be an avoidable trigger because it is a precipitating factor. Next, we have our picture. This is a picture of a soccer player that I thought was pretty much related to what we're talking about. This is a common scenario. And if you look, you see that she's in her soccer uniform. She has her soccer ball. And this goes back to what I previously mentioned, a trigger, exercise. During asthma attack, the muscles in the bronchial tubes tighten and thicken, resulting in the constricted airway, as you can see in the picture. This causes the airway to become inflamed and mucus filled. This is a result of the cells involved, such as mast cells, neutrophils, macrophages, TMB lymphocytes, and eosinophils. This causes the common symptom, as you can see at the top, to develop difficulty in breathing. That being said, clinical manifestations. Although asthma symptoms can vary, the most recognized are wheezing, dyspnea, which also can be shortness of breath, chest tightening, and coughing, usually occurring at night or early morning. During a physical exam, a nurse could find the presence of a runny nose, swollen nasal passages, nasal polyps, eczema, or hives. Asthma is a disease that can be cured, but with proper management, symptoms are controllable. Okay, now to our slide about how asthma is diagnosed. So, asthma is actually a pretty underdiagnosed disease, but the steps used in this process is a patient's medical history, which is needing to know what kind or type of drugs they are currently on, which goes back to the triggers, which is one of them being drugs. A physical exam, which can bring forth the observation of wheezing on auscultation during forced expiration. Family history is always an important addition to diagnosing any disease, actually. Is there anyone in the family also diagnosed with this? It's typically like a question that you would ask, like any family member, sister, brother, aunt, uncle, mom, dad, things like that. Then you have lung tests, which are essential in diagnosing asthma or any lung condition. You have your PEFR, peak expiratory flow rate, and it can be used in a home or healthcare setting, which is going to be discussed later in more depth. And then you have spirometry. It's used in a healthcare setting, which ultimately can show obstructed patterns in measurements such as FEV, known as forced expiratory volume. When a spirometry test is scheduled, make sure you let your patient know that they need to stop taking any bronchodilators 6 to 12 hours before tests. Lastly, you have your chest x-rays. And these are usually done, not normally, but they're usually done just to determine if it's something else that's causing symptoms that look like asthma, such as pneumonia or a foreign body that is located in the lungs area. Now, how is asthma classified? According to guidelines, asthma is classified by its severity. Asthma has 4 classifications as it may present itself or progress. These classifications determine the treatment that is received, and they are as followed. Intermittent, you have symptoms that you experience less than twice a week. Experiencing nighttime symptoms less than twice a month. FEV, again, is your forced expiratory volume, and this is 80% or above normal, and it's no interference with activities. Now there's mild. Mild has symptoms that you experience twice a week, experiencing nighttime symptoms 3 to 4 times a month. And as you can see, everything's increasing. Your FEV is the same as previously stated, 80% or above normal, and you have minor interference with activities. Now you have moderate. Your symptoms are experienced daily, nighttime symptoms more than once a week, FEV is 60 to 80%, and increased interference with activity. We have severe. Symptoms are experienced continuously. Experience nighttime symptoms up to 7 times a week. Your FEV is less than 60% and extreme interference with activities. Now, this picture is to represent the prevalence of asthma in the U.S. As previously mentioned, asthma is seen mostly in women in adulthood. As you can see in the chart, it represents this. And this goes to show the prevalence in race. The most diagnosed race, if you look, is Puerto Ricans, following multiple race, and then lastly, African Americans. Patients in all classifications require a short-term medication, such as albuterol or Proventil. Patients with persistent asthma must be on a long-term medication, such as your bronchodilators like Servant or Foradil. Your inhaled corticosteroids are the most common drugs to treat inflammation and more effective in improving asthma control. Patient teaching is required for each medication, such as corticosteroids being taken by postmenopausal women They need to know they need to include vitamin D and calcium supplements in their regimen. Or in short acting, there needs to be caution with patients with cardiac disorders because it can increase blood pressure or heart rate, but it also needs to be known that it's always used to treat sudden wheezing. In this picture, we go back to the soccer player. The difference is she's using her inhaler with a spacer. If you have asthma and know your asthma is triggered by exercise, it is encouraged to use the inhaler 15 to 30 minutes before to prevent any symptoms related to asthma. Patient teaching, as we all know, is needed in nursing practice. We need to know that with patients that are diagnosed with asthma, we need to include the basic information regarding medications, knowing when they need to take it, knowing what they're taking, knowing what can contraindicate which medication, knowing how long they're supposed to take the medication. You need to let your patient know that. Poor adherence is common in people that are diagnosed with asthma because again, it has no cure, so it is a long-term treatment regimen that these patients have to adapt to. You need to teach them how to use inhaler devices, and if they are in a clinical setting, you need to be able to reassess their technique, make sure they're using it correctly. Avoid triggers is the main thing that you need to emphasize to your patients. Your primary goal is to maximize self-manage and encourage the communication between them and their healthcare provider. And they must know how to measure their peak flow, and they need to know that they need to do it daily. As stated before, we come back to the peak flow device. I included a picture because I don't know about y'all, but I've never seen one in person, so I just wanted to provide a visual to y'all just so you guys can know what it could look like. When given this device, the patient and the healthcare provider must set up normal flow rates to put into the device so they can add the colors like a traffic light. Being in the green zone means proceed with normal meds and no asthma symptoms are present. Then, if you're in the yellow zone, indicates caution and something is triggering the symptoms of asthma. If you remain in this zone, take an inhaled short-acting medication. Red zone obviously means stop what you're doing. It means a medical alert and they need to take a short-acting medicine immediately. The healthcare provider or emergency department also needs to be contacted immediately. In my literature review, I looked up an article and it was titled Asthma Self-Management in Adults, a Review in Current Literature. This study and article was based in Australia, so obviously these things don't necessarily apply to us in the United States, but it was still interesting to find out. So basically, this article goes on to state that self-care performed by individual improves the outcomes from this disease. As we all know, if you make sure that you manage your disease, you can avoid some symptoms that can cause reactions that will cause you to come into the emergency department. As long as you do your self-care daily, taking your medications, avoiding the triggers, it leads to less frequent exacerbations. Self-management is based on the patient's perception of the disease. If they are not properly taught what asthma is or how it is managed, then obviously they will not know how to care for the disease. And this goes back to patient teaching, which a nurse, that is one of the nurse's roles. Then we can have self-management ultimately does not replace medical care, but it creates an active participant throughout his or her lifetime. So this article basically, the main focus is that as long as you create a patient that is able to accept the teaching that is coming to them, they will lead an effective life. And that is in. Anything, comments, concerns? No? Well, I hope that you guys enjoyed my presentation on asthma. Hope I didn't bore you guys too much. Okay. So thank you guys for listening to me, and I hope you guys have a good day. Thank you.